The Public Health Officers Association of the Gambia on Monday ended their 6-day sit-down strike after reaching a deal with the government of the Gambia over the payment of their allowances. It could be recalled that on the 6th of April 2022, public health officials embarked on a sit-down strike after their exclusion from an allowance scheme created for staff of the Health Ministry. The public health officers complained that both their past and the current executive have been allowance taxes. Also faces had several engagements with the senior management of the Ministry of Health dating back to March 2021, but nothing concrete came from those meetings. Let's hear details in this report by Mafuji Sise.
The public health officer says they face lots of discrimination and have fallen victims of cadred unjust treatment by authorities of the Ministry of Health. This unjust treatment include but not limited to unjustified officers' demotion, of redeployment of senior public health officers and undermining them. Mr. Musa Wanget, the Vice President of the Public Health Association, reassured the public of their continuous commitment to the advancement of public health in the Gambia, saying they are firm believers of the conviction and resilience, unshakable but also deserve a dignified pay and treatment.
We wish to submit to the notice of the general public that as part of the resolution that we agreed upon by the Emergency Congress, that we have finally arrived at a conclusion that all public health officers should report back to work on Tuesday, 12th April 2022. Marking the end of the first phase of the sit-down strike, this is as a result of our engagement with the Secretary General and Head of Civil Service that our entitled allowances will be paid by end of May. We hope that our demands will be met by the agreed date to reoccurrence of such a situation in the future.
Noah Fofana is the president of the Public Health Association, says they are also asking for the same pay for risk allowance which the other health officials are paid. Whether the allowance is a right or privilege, President Fofana has this to say.
We are promised of these said allowances that we are requesting for. So please, it is not something, we are coming up. And there are allowances which are applicable to our cadre. Because in fact, one of them, which is the on-call allowances, is not meant for all the public health officers. But it is only meant for desk officers who are heads of public health offices at the health facility level, and also public health officers who serve at points of entries.
The public health officers contributed immensely to disease surveillance and immunization program. The Gambia has declared polio-free in 2004, and all the polio surveillance indicators have been met to date. The sacrifice of public health officers in the Gambia has led to a huge improvement in environmental sanitation across the country, an example of which is the public health lead intervention called National Open Defecation Free Initiative, which resulted to improve sanitation in many communities and hygiene conditions were significantly improved in many communities. Reporting for Eyeafrica News, I am Mafuji Sise.